Scene 5, take 1. Scene 2, take 1.
Okay.
How you doing?
I'm doing great. How are you?
I was a nurse for 41 years.
18 years.
8 years. 13 years.
So I've been a student nurse.
Started out as a nurse's aide.
And I'm a nurse practitioner.
Assistant head nurse.
I've been an ICU nurse.
Head nurse.
Rapid response nurse.
Supervisor.
Critical care transport nurse.
Manager.
I've done so many things. I'm like, ooh.
Nurse, a person who cares for the sick.
Or infirm.
So would you say that encapsulates everything it is to be a nurse?
Absolutely not.
Nursing is so much broader than that.
Definitely more to it. I think that we do more than that.
Nurses are caretakers.
Caregivers.
Nurses are workhorses.
Scientists, geniuses, educators, leaders, trailblazers, and we're entrepreneurs.
Politicians, athletes, fixers, especially with tape. Mothers, fathers.
Sons, daughters.
Nurses are human beings who are
Empathetic,
kind,
underpaid.
overworked, and nurses are fabulous.
To me, nurses are just caring people.
Nurses are very powerful.
Powerful,
Protectors.
Strong.
It's hard to put what we do into one word.
the small amount of time that I'm able to make a difference in a patient's life really feeds my soul, and there is nothing else I would rather do.
It's so rewarding and joyful when you can get your patient well and send them home to their family. That is like the greatest joy. It's not just a job. It's never just a job. It's really a dedication.
You're always feeling a calling to go and help and treat patients and try to do the best that you can.
There's no greater feeling than doing CPR on a patient and getting a pulse back. It's one of the greatest highs.
The most challenging aspect of being a nurse is knowing that you did everything for the patient, even if the outcome is negative. When the outcome is positive, everybody's happy and smiling. The outcomes are not always positive because that's just life. But you have to know that you did the best that you can.
And then after your shift, you have to go home and, be a father, husband. That's tough.
My first career was on Wall Street. My life changed when I saw the second plane hit on September 11th. And since then, I started thinking about what I would do next to make my life more fulfilling. I will never make the money I made back then, but community and people, I've realized, is more important.
I am a second-generation nurse. My mother is a retired nurse. So the feeling of walking across that stage and obtaining my nursing degree definitely hit home for her, and I can see the tears of joy.
I know it sounds kind of cliche, but from the time I was a little girl, I wanted to be a nurse. And when I got into it, I thoroughly loved it. I'm not going to lie and say there weren't hard times and bad times, but I just loved being a nurse.
Nurses are more than what you see at the bedside. We do so many things.
As a nursing supervisor in school health, I was at a school and I was dressed similar to the way I am now. And I met with the principal of the school and she says, "I've never seen a nurse dressed like you." Most people say, "What hospital do you work in?" That's been the question I've had all my life. And I said, "I haven't worked in a hospital in over 40 years.
We are entrepreneurs, we are leaders.
Nurses, you are powerful.
We have been integral in the shortage of healthcare providers that this country has faced.
As nurses, we metaphorically hold the hospital, our patients, and healthcare together. The greatest part of being a nurse was just taking care of my patients, being there for them, just to help them, and just to advocate for them.
Nurses are friends to the patients as well as the families and to each other.
How long have you known each other for?
A long time.
We are friends forever. We're sisters. The bond that we have, no one could take away.
Teamwork is very important.
We need to collaborate with the doctors, the respiratory therapists, family members, the pharmacists. There's a lot of teamwork involved with being a nurse.
That's a camaraderie with nurses, and that's what I had. We were all just there for each other, and we have each other's backs.
Happy Nurses Week!
This Nurses Week,
NurseJournal is celebrating what it
truly means to be a nurse.
Because nurses are so much more than just
caregivers at the bedside.
Because a nurse is never just a nurse. Sky's the limit. There's so much we can do, and I don't think that we all as a community know the power that we have in healthcare.
I love being a nurse. I love what I do. I love taking care of patients. I love taking care of their families. I can't see myself doing any other profession.
Becoming a nurse and going to nursing school, I've learned a lot about myself, who I was, and even today I learn something new every day. I feel like I made the best decision ever.
And it's not an easy trek, it's not an easy job, but we do it because we know we have to do it, and we want to do it because it's a job that has to be done. I'm proud to be a nurse. Once a nurse, always a nurse.